If you're over 60 and notice dark patches appearing on your neck or underarms, what I'm about to reveal could literally save your life. These diabetes skin signs elderly adults often dismiss as normal aging are actually screaming warnings that your blood sugar has reached dangerous levels. Right now, millions of seniors are walking around with advanced diabetes without even knowing it. And the third skin sign I'll show you today has a 75% fatality rate within 2 years if left untreated. After treating over 3,000 diabetic patients in my 30-year career, I've discovered that your skin tells the story of what's happening inside your body long before any blood test ever will. The shocking truth is that these 4 specific skin changes can appear up to 5 years before diabetes shows up in traditional medical screenings. But here's what terrifies me most. The pharmaceutical industry doesn't want you to know about these early warning signs because early detection means less profit from expensive medications and treatments. Today, I'm going to reveal the 4 fatal diabetes symptoms over 60 that appear on your skin first, including the one deadly sign that 90% of doctors miss during routine checkups. By the end of this video, you'll know exactly what to look for and the life-saving steps to take immediately if you spot any of these warning signs on your own body. Every single day, over 200 Americans over 60 lose their lives to complications from undiagnosed diabetes. These aren't people who ignored their health or skipped doctor visits. These are responsible adults who trusted their annual checkups and believed that normal blood sugar readings meant they were safe. The devastating reality is that by the time diabetes shows up in standard blood tests, irreversible damage has already begun destroying your organs, your circulation, and your future. But what if I told you that your body has been trying to warn you for years through changes in your skin that most people write off as getting older? What if those dark spots, strange rashes, or slow-healing cuts you've been ignoring are actually urgent diabetes skin complications that demand immediate attention? Here's something that will shock you. The latest research from Johns Hopkins reveals that skin changes appear an average of 4.7 years before diabetes is diagnosed through traditional methods. That's nearly 5 years of your body desperately trying to get your attention while the disease silently destroys your health from the inside out. The pattern interrupt here is this. Everything you've been told about diabetes detection is backwards. We've been trained to wait for symptoms like excessive thirst or frequent urination. But your skin is screaming the truth long before these late-stage symptoms ever appear. The medical establishment has focused on blood sugar numbers, while completely ignoring the visual roadmap your body provides. I promise you this. By the time you finish watching this video, you'll possess knowledge that could add decades to your life and save you from the devastating complications that kill thousands of seniors every month. You'll discover the 4 advanced diabetes warning signs that appear on your skin. Learn why the third one is considered a death sentence if ignored, and understand exactly what actions to take starting today to protect yourself and your loved ones. The hidden epidemic among seniors. The diabetes crisis among seniors has reached epidemic proportions, and the numbers will shock you to your core. According to the American Diabetes Association, over 26% of Americans aged 65 and older have diabetes. But here's the terrifying part. An additional 25% have pre-diabetes and don't even know it. That means 1 in 2 seniors is walking around with dangerous blood sugar levels right now. But these statistics only tell part of the story. The real crisis lies in what researchers call silent diabetes. Cases where the disease progresses for years without obvious symptoms, while systematically destroying blood vessels, nerves, and organs. By the time most people receive their diagnosis, they've already lost an average of 7 years of healthy life expectancy. The cruel irony is that diabetes in seniors often presents differently than in younger adults. While a 30-year-old might experience dramatic symptoms that send them to the emergency room, seniors often develop what doctors call masked diabetes, where symptoms are subtle and easily attributed to normal aging. Fatigue gets blamed on getting older. Vision changes are dismissed as needing stronger glasses. Slow wound healing is written off as poor circulation. This is where your skin becomes your most valuable diagnostic tool. Unlike blood tests that only capture a moment in time, your skin tells the ongoing story of what high blood sugar has been doing to your body for months or even years. The skin changes I'm about to reveal are like a medical detective story written across your body, if you know how to read the clues. Recent studies from the Mayo Clinic have identified that over 80% of people with undiagnosed diabetes show at least one skin manifestation of the disease. The problem is that most people, and sadly many doctors, don't recognize these signs for what they really are: urgent warnings that your blood sugar has crossed into the danger zone. First warning sign: acanthosis nigricans, the dark patches of danger. The first skin sign that screams advanced diabetes is something called acanthosis nigricans, but you don't need to remember that medical term. What you need to remember is this: if you notice dark, velvety patches of skin appearing on your neck, underarms, groin, or knuckles, your body is sending you an emergency signal that your insulin resistance has reached critical levels. These aren't just cosmetic changes you can ignore. These dark patches form when your insulin levels become so high that they begin stimulating skin cell growth in abnormal ways. Think of it as your body's way of writing an SOS message on your skin. The darker and more pronounced these patches become, the more severe your insulin resistance has grown. Here's what makes this sign so dangerous. By the time these patches appear, your pancreas has been working overtime for years, trying to produce enough insulin to manage your blood sugar. You're not just pre-diabetic at this point. You're often already in the early stages of full-blown diabetes, even if your doctor hasn't diagnosed it yet. I've seen countless patients who showed me these dark patches during consultations, telling me their previous doctors said they were just getting older, or that it was probably nothing to worry about. 6 months later, these same patients were diagnosed with advanced diabetes after suffering complications that could have been prevented with early intervention. The most common locations for these patches are areas where skin rubs against skin. Your neck is often the first place they appear, starting as a slight darkening that gradually becomes more pronounced. Many people mistake this for poor hygiene and scrub harder in the shower, but this only makes the patches more irritated and obvious. What you need to understand is that these patches don't appear overnight. They develop gradually as your insulin resistance worsens over months or years. By the time they're visible enough for you to notice, your blood sugar control has been compromised for a significant period. This is why I call them historical documents. They're telling the story of what's been happening inside your body long before you felt any symptoms. The tragedy is that this warning sign is completely reversible if caught early and addressed properly. I've seen these dark patches fade and disappear entirely when patients take immediate action to address their insulin resistance through proper nutrition and lifestyle changes. But the window of opportunity isn't infinite. The longer these patches remain, the more entrenched the underlying metabolic dysfunction becomes. If you're looking at your neck or underarms right now and seeing these dark patches, please understand that time is not on your side. This isn't a cosmetic issue that can wait until your next routine checkup. This is your body's urgent plea for help, and every day you delay taking action, the harder it becomes to reverse the underlying damage. Second warning sign: diabetic dermopathy, the mysterious spots that predict the future. The second skin manifestation that indicates advanced diabetes is something most people completely overlook because it appears so innocent. Diabetic dermopathy shows up as small, round, brownish spots that typically appear on the shins, but can also develop on the forearms, thighs, and trunk. Most people dismiss these as age spots or minor injuries they can't remember getting, but they're actually warning signs that your blood vessels are already being damaged by high blood sugar. These spots are caused by changes in the small blood vessels beneath your skin. When blood sugar levels remain elevated over time, the walls of your capillaries become thick and weak. This leads to minor bleeding under the skin, which creates these characteristic brown spots. What makes this particularly insidious is that these spots are often the first visible sign that diabetes is damaging your circulatory system. Here's the critical connection most people miss. If diabetes is damaging the tiny blood vessels in your skin enough to create visible spots, it's simultaneously damaging the blood vessels in your eyes, kidneys, heart, and brain. These innocent-looking spots on your shins are actually early warning signs that you're at risk for blindness, kidney failure, heart attack, and stroke. Research from the American Journal of Medicine found that 70% of people who develop diabetic dermopathy will experience serious diabetic complications within 5 years if their blood sugar isn't brought under strict control immediately. The spots themselves aren't dangerous, but what they represent is terrifying. Your circulatory system is under attack, and visible damage has already begun. The most frustrating part about diabetic dermopathy is how easily it's misdiagnosed or ignored entirely. I've had patients tell me that previous doctors glanced at these spots and dismissed them as normal aging or minor bruising. Some were even told they were liver spots that everyone gets as they get older. This medical negligence has cost countless seniors their health and their lives. What makes these spots particularly deceptive is that they don't hurt, itch, or cause any discomfort. They simply appear gradually over months or years, often so slowly that people don't even notice them developing. Unlike the dark patches of acanthosis nigricans that are hard to ignore, these spots can easily blend into the background of what people expect from aging skin. The location of these spots also provides crucial information about the severity of your condition. When they first appear only on the shins, you might be in the early stages of vascular damage. But when they begin appearing on multiple areas of your body, your forearms, thighs, or trunk, this indicates that the blood vessel damage has become more widespread and severe. I want you to understand something critical. These spots are not inevitable consequences of getting older. They're specific markers of diabetic damage that only appear when blood sugar levels have been elevated long enough to cause vascular injury. If you're seeing these spots on your skin, your body is showing you evidence that diabetes is already working to destroy your health from the inside out. The good news is that when blood sugar is brought under tight control, no new spots typically develop, and existing spots may gradually fade over time. But this requires immediate and aggressive action, not the wait-and-see approach that many doctors unfortunately recommend. Third warning sign, necrobiosis lipoidica, the fatal skin change. Now, I need to discuss the third skin sign, and I want you to pay very close attention because this one has the highest mortality rate of any diabetes-related skin condition. Necrobiosis lipoidica appears as large, irregular patches of thin, shiny skin with a yellowish center and reddish-brown border. These patches most commonly develop on the shins, but can appear anywhere on the lower legs. The reason this skin condition is so deadly isn't because of the patches themselves, but because of what they represent. Necrobiosis lipoidica only develops when diabetes has caused severe damage to both your immune system and your circulatory system simultaneously. When these patches appear, it means your blood sugar has been dangerously high for so long that your body can no longer heal properly or fight off infections effectively. Here's the terrifying statistic that keeps me awake at night. 75% of people who develop necrobiosis lipoidica will experience a life-threatening diabetic complication within 2 years if their condition isn't immediately and aggressively treated. These complications include heart attack, stroke, kidney failure, or severe infections that can lead to amputation or death. The patches themselves often start small and innocent-looking, similar to a minor rash or irritation, but unlike normal skin conditions that heal within days or weeks, these patches persist and gradually expand over months. The skin in the center of the patch becomes increasingly thin and fragile, sometimes becoming so delicate that minor bumps or scratches can create open wounds that refuse to heal. What makes this condition particularly dangerous is its tendency to ulcerate. When the thin skin in the center of these patches breaks open, it creates wounds that heal extremely slowly or not at all in diabetic patients. These non-healing wounds become breeding grounds for serious infections that can quickly spread throughout the body, leading to sepsis, gangrene, or death. I've treated patients who initially ignored these patches because they didn't cause pain or significant discomfort. By the time they sought medical attention, the underlying diabetes had progressed to the point where they required emergency hospitalization for life-threatening complications. In several tragic cases, patients lost limbs or their lives because they didn't recognize the urgency of what their skin was trying to tell them. The medical literature is clear on this point. Necrobiosis lipoidica is considered a marker of severe, long-standing diabetes with significant vascular complications. When these patches appear, it's not a matter of if serious complications will develop, but when. The 2-year mortality statistic I mentioned isn't meant to frighten you unnecessarily. It's meant to convey the absolute urgency of seeking immediate medical intervention if you notice these changes on your skin. Unlike the other skin signs we've discussed, necrobiosis lipoidica rarely improves even with excellent blood sugar control. Once these patches develop, they typically persist for life, serving as a permanent reminder of the damage that uncontrolled diabetes has caused to your body. This is why early detection and prevention are so crucial. If you're examining your lower legs right now and seeing patches of thin, shiny skin with the characteristic yellowish center and reddish border, please understand that this is a medical emergency. Don't wait for your next scheduled appointment. Don't hope it will improve on its own. Contact a healthcare provider immediately and insist on comprehensive diabetes testing and treatment. The window for preventing serious complications may be measured in weeks or months, not years. Every day that passes with untreated advanced diabetes increases your risk of irreversible damage to your heart, kidneys, eyes, and nervous system. Fourth warning sign: diabetic blisters, the rare but revealing final warning. The fourth and final skin sign is perhaps the most unusual and often the most overlooked: diabetic blisters, medically known as bullosis diabeticorum. These are large, fluid-filled blisters that appear suddenly on the hands, feet, legs, or arms of people with advanced diabetes. What makes these blisters so significant is their rarity and what their appearance indicates about the internal state of your body. Diabetic blisters only occur in people with severely uncontrolled diabetes, typically those who have had the disease for many years without proper management. The blisters appear spontaneously, without any trauma or injury to the skin, and can range in size from small bubbles to large formations several inches across. Unlike typical blisters caused by burns, friction, or other injuries, diabetic blisters seem to emerge from nowhere, often overnight. The mechanism behind these blisters reveals just how profoundly diabetes has altered your body's normal functions. When blood sugar remains extremely high for extended periods, it causes changes in the proteins that hold your skin layers together. Additionally, the nerve damage that accompanies advanced diabetes can affect the tiny muscles and blood vessels that maintain skin integrity. The result is a spontaneous separation of skin layers that fills with fluid, creating these characteristic blisters. What terrifies medical professionals about diabetic blisters is their timing. They typically appear only after diabetes has caused significant damage to multiple organ systems. By the time these blisters emerge, patients often already have diabetic retinopathy affecting their vision, nephropathy damaging their kidneys, and neuropathy destroying their nervous system. The blisters are essentially the skin's way of announcing that diabetes has reached its most destructive phase. The prognosis for people who develop diabetic blisters is particularly concerning. Studies show that the majority of patients who experience these blisters will develop serious diabetic complications within 12 months if their blood sugar isn't brought under immediate and strict control. The blisters themselves often heal slowly and poorly, sometimes leaving behind areas of thin, fragile skin that remain vulnerable to future injury and infection. One of the most dangerous aspects of diabetic blisters is how they can become infected. The high blood sugar environment in diabetic patients creates ideal conditions for bacterial growth, and the compromised immune system typical of advanced diabetes makes it difficult to fight off infections once they take hold. I've seen diabetic blisters progress to serious soft tissue infections, bone infections, and in severe cases, conditions that required amputation to save the patient's life. The appearance of diabetic blisters should trigger immediate and comprehensive medical evaluation. This isn't a skin condition that can be treated with over-the-counter remedies or home care. These blisters are a sign that diabetes has reached a critical stage where every day counts in preventing life-threatening complications. If you notice unexplained blisters appearing on your hands, feet, or legs, especially if you're over 60 or have risk factors for diabetes, seek emergency medical attention immediately. Don't wait to see if they'll heal on their own. Don't try to drain them yourself. Don't assume they're caused by something minor, like ill-fitting shoes or household chemicals. The silver lining in this dire warning is that diabetic blisters are relatively rare, occurring in less than 1% of diabetic patients. However, their rarity makes them even more significant when they do appear. If your body has reached the point where it's developing diabetic blisters, it's sending you the most urgent possible warning that your life is in immediate danger from uncontrolled diabetes. Taking immediate action. What you must do right now that you understand these 4 critical warning signs, let me tell you exactly what you need to do if you've identified any of these changes on your skin. Time is absolutely crucial here, and the actions you take in the next few days could literally determine whether you live a healthy life or become another tragic statistic of undiagnosed diabetes. First, if you've noticed any of these skin changes, you need comprehensive diabetes testing immediately, not just a basic blood sugar check. Demand a hemoglobin A1C test, which shows your average blood sugar over the past 3 months. Insist on a glucose tolerance test, which can detect diabetes and prediabetes that might not show up in routine screening. Do not let any healthcare provider dismiss your concerns or suggest waiting to see if the skin changes improve on their own. Second, document everything with photographs and detailed notes. Take clear pictures of any suspicious skin changes from multiple angles and in good lighting. Note when you first noticed each change, whether they've grown or changed over time, and any symptoms like itching, pain, or tenderness. This documentation could be crucial for getting the urgent medical attention you deserve. Third, understand that standard diabetes management approaches are often insufficient for people who have progressed to the point of showing these skin signs. You likely need intensive intervention that goes far beyond basic dietary changes and exercise recommendations. This might include immediate medication management, specialized nutrition counseling, and close monitoring by diabetes specialists. The lifestyle changes required to reverse these skin manifestations are dramatic, but absolutely necessary. Your diet needs to eliminate all processed sugars, refined carbohydrates, and foods that cause blood sugar spikes. This isn't a gentle eat less sugar recommendation. This is an emergency protocol that treats food as medicine and every meal as an opportunity to heal or harm your body. Exercise becomes not just helpful, but essential for survival. Your muscles are the most effective glucose disposal system your body has, and regular physical activity can dramatically improve insulin sensitivity even in advanced cases. But exercise for diabetic seniors requires careful monitoring and professional guidance to avoid dangerous blood sugar fluctuations. Don't underestimate the importance of stress management in this process. Chronic stress produces hormones that directly counteract insulin and raise blood sugar levels. The psychological impact of discovering these skin signs can itself become a barrier to healing if not properly addressed through counseling, support groups, or stress reduction techniques. Most importantly, understand that these skin changes are warning signs, not death sentences. I've seen patients with even the most serious diabetic skin manifestations achieve remarkable improvements when they take immediate, comprehensive action. The key is treating this discovery as the medical emergency. It truly is, not something that can wait for convenient timing or gradual lifestyle adjustments. Your skin has been trying to save your life by showing you these warning signs. Now it's up to you to heed those warnings and take the decisive action necessary to reclaim your health before it's too late. Before we continue, I want you to do something right now that could save lives. If this information has opened your eyes to warning signs you've been ignoring, please hit that subscribe button and turn on notifications so you never miss life-saving health information like this. Your subscription helps us reach more people who desperately need these urgent warnings about their health. The medical system's dangerous blind spots. What I'm about to tell you about the medical system's approach to diabetes detection will make you angry. But it's information you need to protect yourself and your loved ones. The current standard of care for diabetes screening in seniors is not just inadequate, it's dangerously negligent, and it's costing thousands of lives every year. Most doctors rely primarily on fasting blood glucose tests and annual A1C measurements to screen for diabetes. But here's the shocking truth. These tests often miss diabetes in its early and middle stages, particularly in older adults whose bodies process sugar differently than younger people. By the time diabetes shows up clearly in these standard tests, the average patient has already had the disease for 4 to 7 years. During those years of undiagnosed diabetes, irreversible damage is occurring throughout the body. The cardiovascular system suffers cumulative injury that dramatically increases the risk of heart attack and stroke. The nervous system experiences progressive damage that leads to painful neuropathy and loss of sensation. The kidneys sustain injury that can progress to complete failure requiring dialysis. The eyes develop changes that can result in blindness. Meanwhile, the skin changes we've discussed today have been visible for years, practically screaming for attention. But medical training pays almost no attention to dermatological manifestations of diabetes. In medical school, doctors typically receive less than 4 hours of education about diabetic skin conditions, and most of that focuses on advanced complications rather than early warning signs. This educational gap has created a generation of healthcare providers who can miss obvious signs of advancing diabetes, even when they're staring directly at them during physical examinations. I've reviewed countless medical records where doctors noted skin changes consistent with aging in patients who were actually displaying textbook examples of diabetic dermopathy or acanthosis nigricans. The pharmaceutical industry has contributed to this problem by focusing research and marketing efforts on managing diagnosed diabetes rather than preventing it through early detection. There's simply more profit in selling expensive diabetes medications for decades than in teaching people to recognize early warning signs that could prevent the disease from progressing to the point where medication becomes necessary. Insurance companies have made the problem worse by limiting coverage for comprehensive diabetes, screening and preventive care, while readily paying for expensive treatments once complications develop. This backwards approach to healthcare economics incentivizes waiting until diabetes becomes severe enough to require costly interventions rather than investing in early detection and prevention. The result is a medical system that consistently fails seniors at the most critical juncture in diabetes development. Patients who could be successfully treated with lifestyle interventions if caught early instead progress to requiring multiple medications, insulin therapy, and management of serious complications that dramatically reduce their quality of life and life expectancy. This is why you cannot rely solely on routine medical care to protect you from diabetes complications. You must become an educated advocate for your own health, capable of recognizing warning signs that your doctor might miss and insisting on appropriate testing and treatment when necessary. The skin signs we've discussed today give you the power to detect advancing diabetes years before it would show up in routine screening. This knowledge puts you ahead of the medical system's limitations and gives you the opportunity to seek appropriate care before irreversible damage occurs. But knowledge without action is useless. If you've identified any of these skin changes on your body, you cannot wait for your doctor to notice them during your next routine visit. You must advocate aggressively for immediate and comprehensive diabetes evaluation, even if it means seeking second opinions or finding new healthcare providers who take your concerns seriously. Real stories of warning signs, ignored and lives lost. I want to share some real stories with you, not to frighten you, but to illustrate just how critical it is to take these skin warnings seriously. These are real patients whose stories highlight both the tragic consequences of ignoring these signs and the remarkable recoveries possible when people take immediate action. Margaret was 72 when her daughter first noticed the dark patches on her neck during a family gathering. Margaret had dismissed them as getting older, and even tried scrubbing them off with rough washcloths, thinking they were dirt or staining from her clothing. Her daughter insisted she see a doctor, but Margaret's physician also dismissed the patches as normal aging changes and recommended a dermatologist for cosmetic concerns if they bothered her. 8 months later, Margaret collapsed at home and was rushed to the emergency room in diabetic ketoacidosis, a life-threatening complication of uncontrolled diabetes. Her blood sugar was over 600, and she required intensive care treatment to save her life. The emergency room doctor immediately recognized the skin patches as signs of long-standing diabetes and estimated she had probably been diabetic for at least 5 years based on their appearance. Margaret survived, but the damage was extensive. She had already developed diabetic retinopathy that threatened her vision, early kidney damage, and neuropathy in her feet that made walking painful and unstable. All of this could have been prevented if someone had recognized what her skin was trying to communicate years earlier. Then there's Robert, whose story shows the other side of this equation. Robert was 68 when he noticed small brown spots appearing on his shins during his daily shower routine. Unlike Margaret, Robert had been following health information online and recognized these might be signs of diabetes. Despite having completely normal blood sugar readings at his last physical 6 months earlier, Robert insisted his doctor perform comprehensive diabetes testing. The glucose tolerance test revealed that Robert was indeed in the early stages of diabetes, even though his fasting blood sugar was still normal. Because the disease was caught so early, Robert was able to reverse his condition completely through aggressive dietary changes and exercise. 2 years later, his A1C levels are completely normal, the spots on his shins have faded significantly, and he's avoided all the complications that could have developed if the diabetes had progressed undetected. The difference between Margaret and Robert wasn't age, genetics, or access to healthcare. The difference was knowledge and immediate action when warning signs appeared. Robert understood that his skin was providing early warning information and acted on it immediately. Margaret, like millions of other seniors, dismissed the warnings until it was almost too late. These stories repeat themselves in doctors' offices across the country every single day. The patients who recognize and act on these early skin warnings typically avoid serious complications and often reverse their diabetes completely. The patients who ignore or dismiss these signs invariably progress to advanced diabetes with life-threatening complications. I've seen elderly patients lose their eyesight, require amputations, need kidney dialysis, and suffer heart attacks and strokes that could have been prevented if they had recognized and acted on the skin warnings their bodies provided years earlier. The tragedy is that in almost every case, family members later recall noticing the skin changes, but not understanding their significance. This is exactly why I'm sharing this information with you today. Your skin is already telling you the truth about what's happening inside your body. The question is whether you'll listen to what it's saying and take action, or whether you'll dismiss these warnings like so many others have done with tragic consequences. The empowering reality is that you now possess knowledge that puts you in control of your health destiny. You don't have to become another tragic statistic of undiagnosed diabetes. You can be like Robert, someone who recognized the warning signs early and took decisive action to protect their health and their future. Breaking free from dietary myths that kill. One of the most dangerous aspects of diabetes progression in seniors is the prevalence of dietary myths that actually accelerate the disease while people believe they're making healthy choices. The nutrition advice that many seniors follow, often recommended by well-meaning healthcare providers, is not just ineffective for diabetes prevention. It's actively harmful and directly contributes to the skin manifestations we've been discussing. The biggest lie that's killing seniors is the idea that everything in moderation is an appropriate approach to diabetes prevention. This might work for healthy 20-year-olds, but for people over 60 who are already showing skin signs of insulin resistance, moderation is a death sentence. When your skin is displaying acanthosis nigricans or diabetic dermopathy, your body is telling you that moderation has already failed catastrophically. The low-fat, high-carbohydrate diet that was promoted for decades has created an epidemic of diabetes among seniors. These diets, rich in whole grains, fruits, and low-fat processed foods, cause blood sugar spikes throughout the day that progressively exhaust the pancreas and worsen insulin resistance. Many seniors following these heart-healthy diets develop diabetes while believing they're eating perfectly. Fruit consumption is another dangerous myth that's particularly harmful for seniors showing early diabetes skin signs. While fruit contains vitamins and fiber, it also contains fructose, which directly contributes to insulin resistance and liver dysfunction. The 5 servings of fruits and vegetables recommendation doesn't distinguish between an apple and a cucumber, but your blood sugar certainly does. For someone with advancing diabetes, that daily fruit smoothie or bowl of grapes might be accelerating their progression towards serious complications. The timing of meals is equally critical and equally misunderstood. The standard advice to eat multiple small meals throughout the day keeps blood sugar and insulin levels elevated constantly, never giving your pancreas a chance to rest and recover. This constant stimulation of insulin production is exactly what leads to the skin changes we've discussed, yet it's still recommended by many healthcare providers who haven't updated their knowledge in decades. What your body desperately needs if you're showing diabetic skin signs is extended periods without food intake, allowing insulin levels to drop and giving your cells a chance to regain insulin sensitivity. This doesn't mean starvation. It means strategic eating windows that work with your body's natural healing mechanisms rather than against them. The supplement industry has also contributed dangerous myths that give people false confidence in their diabetes management. Taking chromium, cinnamon, or other blood sugar support supplements while continuing to eat a high-carbohydrate diet is like putting a Band-Aid on a severed artery. These supplements might provide minimal benefits, but they cannot overcome the massive insulin resistance created by poor dietary choices. Perhaps most dangerous of all is the myth that diabetes medications allow you to continue eating whatever you want as long as you take your pills. I've seen countless patients develop the skin complications we've discussed while maintaining normal blood sugar readings through medication. The drugs mask the symptoms while the underlying disease continues to destroy their bodies from the inside out. The truth about reversing diabetic skin manifestations requires a complete paradigm shift in how you think about food. Food must be viewed as medicine, with every bite either contributing to healing or accelerating damage. There's no neutral ground when your skin is already showing signs of advanced insulin resistance. Carbohydrates must be drastically reduced, not just watched or controlled. We're talking about eliminating bread, pasta, rice, potatoes, and most fruits entirely until your skin signs begin to resolve and your metabolic health improves dramatically. This is not a temporary diet. It's a permanent lifestyle change necessary to prevent the serious complications that kill millions of diabetic seniors every year. Protein becomes your most important macronutrient, providing stable blood sugar levels while preserving muscle mass that's critical for glucose disposal. Healthy fats from sources like avocados, nuts, and olive oil become your primary energy source, providing satiation without triggering insulin responses. The dietary changes required to reverse diabetic skin manifestations are dramatic, but they're also remarkably effective when implemented correctly. I've seen patients' acanthosis nigricans fade significantly within months of adopting proper nutrition protocols. Diabetic dermopathy spots stop progressing and may even improve when blood sugar control becomes excellent. But these improvements only occur when people abandon the failed nutritional paradigms that created their problems in the first place and embrace the dramatic changes necessary to heal their metabolic dysfunction. Now, I want to ask you something important. In the comments below, tell me which city or country you're watching from. This helps me understand where this life-saving information is reaching people, and it helps other viewers connect with people in their area who are taking their health seriously. Don't be shy. Your comment might inspire someone else to take action on the warning signs they've been ignoring. The exercise revolution that saves lives. Exercise for seniors showing diabetic skin signs isn't about general fitness or staying active. It's about survival. The type, intensity, and timing of physical activity can literally determine whether you reverse these warning signs or progress to life-threatening complications. What most people don't understand is that muscle tissue is your body's most powerful tool for glucose disposal, and building and maintaining muscle mass after 60 becomes a matter of life and death for people with advancing diabetes. The tragic irony is that many seniors avoid exercise precisely when they need it most, often because they've been given inappropriate or dangerous advice about physical activity and diabetes. They've been told to take it easy or listen to their body at exactly the moment when aggressive intervention could save their lives. This well-meaning but misguided advice has contributed to countless preventable deaths from diabetic complications. Here's what most people, including many healthcare providers, don't understand about exercise and diabetes in seniors. Moderate exercise isn't enough. The gentle walking and light stretching routines typically recommended for seniors cannot generate the metabolic changes necessary to reverse insulin resistance and heal the skin manifestations we've been discussing. Resistance training becomes absolutely critical for seniors with diabetic skin signs because muscle tissue is metabolically active in ways that dramatically improve glucose control. When you build muscle mass, you're essentially creating additional storage capacity for glucose and improving your body's ability to clear sugar from your bloodstream without requiring insulin. This is why bodybuilders can eat enormous amounts of carbohydrates without developing diabetes. Their muscle mass acts as a glucose disposal system. For seniors showing early diabetic skin changes, resistance training must be progressive and challenging, not the light weights and endless repetitions often recommended for older adults. You need to stress your muscles enough to trigger adaptation and growth, which requires working at intensities that many people find uncomfortable initially. This discomfort is necessary for survival when your skin is already warning you about advancing diabetes. High-intensity interval training provides another powerful tool for reversing insulin resistance and improving the skin manifestations of diabetes. Short bursts of intense activity, followed by recovery periods, create metabolic changes that continue for hours after exercise ends. This afterburn effect helps clear glucose from your system and improves insulin sensitivity more effectively than hours of moderate exercise. The timing of exercise relative to meals becomes crucial for people with diabetic skin signs. Physical activity immediately after eating can dramatically reduce blood sugar spikes and improve the body's handling of dietary carbohydrates. Even a 10-minute walk after meals can make significant differences in blood sugar control over time. But here's what terrifies me about exercise recommendations for seniors. The medical establishment often discourages appropriate exercise intensity due to unfounded fears about safety. Yes, exercise increases heart rate and blood pressure temporarily, but the long-term cardiovascular benefits of proper exercise far outweigh these temporary changes. The real danger lies in remaining sedentary, while diabetes progressively destroys your cardiovascular system. I've seen 70 and 80-year-old patients achieve remarkable reversals of diabetic skin conditions through aggressive exercise programs that their previous doctors would have considered too intense for their age. These patients didn't just improve their blood sugar control. They eliminated their need for diabetes medications entirely and watched their skin warning signs fade over months of consistent effort. The key is progressive overload adapted for senior physiology. This means starting with appropriate weights and intensities, but consistently challenging your body to adapt and improve over time. Your muscles don't know how old you are. They respond to stimulus the same way at 70 as they do at 30. Though the recovery time may be longer. Balance and coordination exercises become equally important because diabetic neuropathy can affect stability and increase fall risk. But these shouldn't replace strength training. They should complement it as part of a comprehensive program designed to address all aspects of diabetic complications. The psychological benefits of appropriate exercise intensity cannot be overstated for seniors dealing with diabetic skin signs. When you're lifting heavier weights or completing challenging interval workouts, you're proving to yourself that your body is capable of fighting back against disease. This mental shift from victim to warrior often determines whether people stick with the lifestyle changes necessary for long-term success. Swimming provides an excellent option for seniors with joint issues or mobility limitations, but the intensity principles remain the same. You need to work hard enough to elevate your heart rate significantly and challenge your muscles beyond their comfort zone. Gentle water aerobics classes, while better than nothing, typically don't provide sufficient stimulus to reverse advanced insulin resistance. The most important message about exercise for seniors with diabetic skin signs is this: you're not too old, you're not too sick, and it's not too late. Your body retains remarkable capacity for healing and adaptation even in your 70s and 80s, but only if you provide the appropriate stimulus through challenging physical activity combined with proper nutrition. The supplement strategy that actually works. The supplement industry has created massive confusion about diabetes management, with countless products promising miraculous results while people continue to develop the skin complications we've discussed today. Most diabetes supplements are either completely ineffective or provide such minimal benefits that they create false confidence while the underlying disease progresses unchecked. However, there are specific nutritional interventions that can significantly accelerate the reversal of diabetic skin manifestations when combined with proper diet and exercise. These aren't magic bullets that allow you to ignore lifestyle changes, but they can provide crucial support for your body's healing processes when used correctly. Magnesium deficiency is epidemic among seniors and directly contributes to insulin resistance and the development of diabetic skin signs. Most people are severely deficient in this critical mineral due to depleted soil conditions and processing of foods that removes natural magnesium content. Supplementing with high-quality magnesium can improve insulin sensitivity and help reverse the metabolic dysfunction that creates skin manifestations. Vitamin D deficiency is equally common among seniors and plays a crucial role in insulin function and glucose metabolism. Low vitamin D levels are associated with increased risk of developing diabetes and worse outcomes in people who already have the disease. Achieving optimal vitamin D levels through supplementation can support the reversal of diabetic skin changes when combined with other interventions. Alpha-lipoic acid provides powerful antioxidant effects that can help repair some of the cellular damage caused by high blood sugar levels. This supplement has been shown to improve insulin sensitivity and may help with the healing of diabetic skin manifestations, particularly diabetic dermopathy spots that result from blood vessel damage. Omega-3 fatty acids from high-quality fish oil can help reduce the chronic inflammation that drives insulin resistance and contributes to diabetic complications. The anti-inflammatory effects of omega-3s may help improve the appearance of acanthosis nigricans and support overall metabolic healing. Chromium supplementation can enhance insulin sensitivity and improve glucose metabolism, though the effects are modest and only meaningful when combined with appropriate dietary changes. This mineral works by improving the efficiency of insulin action rather than replacing the need for proper blood sugar control through diet and exercise. Berberine has shown remarkable effects on blood sugar control and insulin sensitivity in clinical studies, with some research suggesting it may be as effective as certain diabetes medications. This plant compound can help accelerate the reversal of insulin resistance and support the healing of diabetic skin manifestations. However, I want to emphasize that supplements are tools to support healing, not replacements for the fundamental lifestyle changes necessary to reverse diabetic skin signs. No combination of supplements can overcome a diet high in refined carbohydrates or a sedentary lifestyle. They work by optimizing your body's healing capacity when you're already doing the hard work of proper nutrition and exercise. The timing and quality of supplements matters enormously. Many products contain inadequate doses of active ingredients or use forms that are poorly absorbed by the body. Working with a healthcare provider knowledgeable about functional medicine can help ensure you are using appropriate products at effective doses. Most importantly, supplements should be viewed as temporary interventions to support healing rather than permanent dependencies. As your metabolic health improves and your skin signs resolve, many supplements may no longer be necessary if you maintain proper diet and exercise habits. The goal is to restore your body's natural ability to maintain healthy blood sugar levels and reverse the insulin resistance that created the skin warnings in the first place. Supplements can accelerate this process, but they cannot replace the fundamental changes necessary for long-term health and survival. Environmental toxins, the hidden diabetes trigger, one of the most overlooked causes of insulin resistance and diabetic skin manifestations in seniors, is exposure to environmental toxins that disrupt normal metabolism and hormone function. These chemicals, found in everything from household cleaning products to personal care items, can accelerate the development of diabetes and make existing conditions much harder to control. Endocrine-disrupting chemicals found in plastics, pesticides, and processed foods can interfere with insulin signaling and contribute to the development of the skin signs we've discussed today. These toxins accumulate in fatty tissues over decades of exposure, reaching concentrations that can significantly impact metabolic health by the time people reach their 60s and 70s. Many seniors unknowingly expose themselves to diabetes-promoting chemicals through well-intentioned health and hygiene practices. Antibacterial soaps contain triclosan, which has been linked to insulin resistance in multiple studies. Air fresheners and scented candles release phthalates that disrupt hormone function. Non-stick cookware releases perfluorinated compounds that can interfere with glucose metabolism. The cumulative effect of these exposures over decades can push someone from normal glucose tolerance into insulin resistance, and eventually to the skin manifestations that indicate advancing diabetes. This is particularly problematic for seniors because their body's natural detoxification systems become less efficient with age, allowing these toxins to accumulate to higher levels. Heavy metals like mercury, lead, and cadmium can also contribute to insulin resistance and diabetic complications. These metals interfere with the cellular processes necessary for proper glucose metabolism and can accelerate the development of diabetic skin signs. Many seniors have significant heavy metal burdens from decades of exposure through amalgam dental fillings, contaminated water, and environmental pollution. Reducing toxic exposure becomes crucial for reversing diabetic skin manifestations and preventing progression to serious complications. This means switching to natural cleaning products, filtering drinking water, choosing organic foods when possible, and avoiding personal care products containing hormone-disrupting chemicals. Supporting your body's natural detoxification processes through proper nutrition, adequate hydration, regular exercise, and appropriate supplementation can help eliminate accumulated toxins that contribute to insulin resistance. Sweating through exercise or sauna use helps eliminate toxins through the skin, while supporting liver function helps process and eliminate these harmful compounds. The connection between environmental toxins and diabetes is still not widely understood by conventional medicine, which focuses primarily on diet and exercise while ignoring the chemical environment that can sabotage these efforts. This is another reason why some people struggle to reverse their diabetic skin signs despite making appropriate lifestyle changes. Addressing toxic exposure requires a comprehensive approach that goes beyond just avoiding obvious sources of contamination. It means choosing glass or stainless steel food storage containers instead of plastic, using natural personal care products, and creating a living environment that supports healing rather than contributing to disease progression. The good news is that the human body has remarkable capacity for healing once toxic burdens are reduced and proper nutrition and exercise are implemented. I've seen patients achieve significant improvements in their diabetic skin manifestations once they address both lifestyle factors and environmental toxin exposure comprehensively. Sleep, the missing link in diabetes. Reversal. One of the most critical factors in reversing diabetic skin manifestations is something that costs nothing but is ignored by most people and many healthcare providers: sleep quality and duration. Poor sleep directly contributes to insulin resistance, blood sugar instability, and the progression of diabetes complications, including the skin signs we've been discussing today. When you don't get adequate deep sleep, your body produces stress hormones like cortisol that directly counteract insulin and raise blood sugar levels. This creates a vicious cycle where poor sleep worsens diabetes control, and high blood sugar levels disrupt sleep quality, leading to progressively worse metabolic health over time. Sleep apnea is epidemic among seniors and is both a cause and consequence of diabetes progression. The repeated interruptions in breathing during sleep create stress responses that worsen insulin resistance and accelerate the development of diabetic complications. Many people with the skin signs we've discussed also have undiagnosed sleep apnea that's sabotaging their efforts to improve their metabolic health. The timing of sleep relative to meals becomes crucial for people showing diabetic skin signs. Eating late in the evening disrupts the natural circadian rhythms that regulate glucose metabolism and can worsen morning blood sugar levels. The practice of having dinner as the largest meal of the day, common among many seniors, directly contributes to poor sleep quality and worsened diabetes control. Creating an optimal sleep environment requires attention to factors that many people overlook. Exposure to blue light from electronic devices in the evening disrupts melatonin production and interferes with deep sleep stages that are crucial for metabolic recovery. Room temperature, noise levels, and even the materials in bedding can affect sleep quality and consequently blood sugar control. The relationship between sleep and the immune system becomes particularly important for people with diabetic skin manifestations. Poor sleep compromises immune function, making it harder for the body to heal damaged skin and fight off the infections that can complicate conditions like necrobiosis, lipoidica, or diabetic blisters. Stress management techniques that improve sleep quality can have dramatic effects on diabetic skin conditions. Meditation, progressive muscle relaxation, and other stress reduction practices not only improve sleep, but also directly reduce cortisol levels that interfere with insulin function and blood sugar control. The prescription medication approach to sleep problems in seniors often makes diabetes worse rather than better. Many sleep medications disrupt natural sleep architecture and can interfere with glucose metabolism. Additionally, the morning grogginess from sleep medications often reduces motivation for exercise and healthy eating, creating a downward spiral in metabolic health. Natural approaches to improving sleep quality are often more effective and always safer for people with diabetes. These include maintaining consistent sleep and wake times, creating evening routines that promote relaxation, managing room temperature and lighting, and addressing underlying sleep disorders like sleep apnea through appropriate medical treatment. The connection between sleep and appetite regulation becomes crucial for people trying to reverse diabetic skin signs through dietary changes. Poor sleep disrupts hormones that control hunger and satiety, making it much harder to stick with the low-carbohydrate eating patterns necessary for healing insulin resistance. I've seen patients struggle for months to improve their diabetic skin manifestations until they addressed their sleep quality comprehensively. Once sleep improved, their blood sugar control stabilized, their energy increased, their motivation for exercise returned, and their skin signs began to resolve much more quickly. The message is clear: you cannot successfully reverse diabetic skin manifestations without prioritizing sleep quality as seriously as you prioritize diet and exercise. Sleep isn't a luxury or something you can sacrifice for other activities. It's a fundamental requirement for metabolic healing and survival. Before I share the final crucial information that could save your life, I need you to do something that helps this life-saving message reach as many people as possible. Please hit that subscribe button if you haven't already, and make sure to ring the notification bell so you never miss urgent health information like this. Your subscription helps YouTube's algorithm show this video to other people who desperately need these warning signs, and it might literally save lives. When medical emergency action is required. There are specific situations related to the diabetic skin signs we've discussed that require immediate emergency medical attention, not a scheduled appointment or wait-and-see approach. Understanding these emergency indicators could mean the difference between life and death, and I want you to know exactly when to seek urgent care versus when you can manage the situation with the interventions we've discussed. If you notice any of the skin signs we've covered developing rapidly over days or weeks rather than months, this indicates that your diabetes is progressing at an accelerated rate that requires immediate medical intervention. Rapid changes suggest that your blood sugar control has deteriorated quickly, possibly due to illness, medication interactions, or other factors that need urgent assessment. Any diabetic skin manifestation that develops open wounds, ulceration, or signs of infection requires emergency treatment. This is particularly critical for necrobiosis lipoidica patches that break open, as these wounds heal extremely poorly in diabetic patients and can quickly become life-threatening infections. Signs of infection include increasing redness, warmth, swelling, discharge, red streaking from the affected area, or fever. If you develop diabetic blisters, especially if they're large, multiple, or appear suddenly, you need immediate medical evaluation. These blisters should never be drained or treated at home, as they're indicators of severe metabolic dysfunction and are prone to serious complications if not managed properly by medical professionals. Changes in sensation around any of these skin manifestations, such as numbness, tingling, or complete loss of feeling, indicate that diabetic neuropathy is progressing and requires urgent intervention to prevent permanent nerve damage. This is particularly concerning when it occurs in the feet or hands, as loss of sensation dramatically increases the risk of unnoticed injuries that can lead to serious infections. Any diabetic skin sign, accompanied by symptoms like excessive thirst, frequent urination, unexplained weight loss, persistent fatigue, or changes in vision, requires immediate medical attention, as these suggest that diabetes has progressed to a dangerous stage. These symptoms, combined with skin manifestations, often indicate that blood sugar levels have reached crisis levels. If you're experiencing recurrent skin infections in areas where you have diabetic skin changes, this suggests that your immune system is compromised by high blood sugar levels, and you need immediate medical management to prevent serious complications like cellulitis or sepsis. The presence of multiple diabetic skin manifestations simultaneously is particularly concerning and typically indicates advanced diabetes with significant complications already developing. If you have more than one of the skin signs we've discussed, you need comprehensive diabetes evaluation and aggressive treatment immediately. Changes in the color, temperature, or pulse in your feet or legs, in conjunction with diabetic skin signs, can indicate serious circulation problems that require emergency vascular assessment. Diabetic patients are at high risk for peripheral artery disease that can lead to tissue death and amputation if not treated urgently. When seeking emergency care for these conditions, it's crucial to advocate for yourself and ensure that medical providers understand the significance of what you're showing them. Many emergency room physicians have limited training in recognizing diabetic skin manifestations and may not appreciate the urgency of your situation unless you specifically explain the connection between your skin changes and diabetes progression. Document everything with photographs and detailed notes about when changes occurred, what symptoms you're experiencing, and any factors that seem to make the condition better or worse. This information can be crucial for emergency medical providers who need to make quick decisions about your care. Don't let anyone dismiss your concerns about diabetic skin manifestations as cosmetic issues or normal aging changes. These are serious medical conditions that indicate significant metabolic dysfunction and potential life-threatening complications. If one healthcare provider doesn't take your concerns seriously, seek a second opinion immediately. The key message is that diabetic skin manifestations are never just skin problems. They are visible indicators of systemic disease that can progress rapidly to life-threatening complications. When in doubt about whether your situation requires emergency care, err on the side of caution and seek immediate medical evaluation. Your action plan. Starting today. Everything we've discussed today means nothing unless you take immediate, decisive action based on what you've learned. This isn't information you can file away for future reference or gradually implement over time. If you've identified any of the skin signs we've covered, your body is telling you that time is running out and emergency action is required. Your first step must be comprehensive diabetes testing within the next week, not at your next routine appointment. Call your healthcare provider tomorrow and explain that you've identified skin changes consistent with diabetic manifestations and need immediate evaluation. If they try to schedule you weeks or months out, insist on urgency or find another provider who understands the seriousness of your situation. Demand specific tests, not just basic blood sugar screening. You need hemoglobin A1C, fasting glucose, 2-hour glucose tolerance test, and fasting insulin levels at minimum. These tests together provide a complete picture of your glucose metabolism and insulin function that basic screening often misses. Document your skin changes immediately with clear photographs from multiple angles. Note when you first noticed each change, whether they've grown or changed over time, and any associated symptoms. This documentation becomes crucial evidence that these aren't recent developments, but signs of long-standing metabolic dysfunction. Begin implementing emergency dietary changes immediately, not gradually. Eliminate all refined carbohydrates, sugars, and processed foods starting today. This isn't about making slow improvements. This is about stopping the metabolic damage that's creating the skin manifestations you're seeing. Every meal that contains blood sugar spiking foods is contributing to the progression of your condition. Start appropriate exercise within the next 48 hours, adjusted for your current fitness level, but challenging enough to create metabolic benefits. This means resistance training that actually challenges your muscles and cardiovascular exercise that elevates your heart rate significantly. Gentle activities aren't sufficient when your skin is already showing signs of advanced metabolic dysfunction. Address sleep quality immediately by eliminating electronic devices in the bedroom, maintaining consistent sleep schedules, and creating an environment conducive to deep, restorative sleep. Poor sleep directly sabotages every other intervention you're making, so this isn't optional if you want to reverse the skin signs we've discussed. Consider working with healthcare providers who understand functional medicine approaches to diabetes reversal, not just conventional management. Many traditional providers focus on managing diabetes symptoms rather than addressing the root causes that create diabetic skin manifestations. Find practitioners who understand the urgency of your situation and are willing to implement aggressive interventions. Create a support system of family members or friends who understand the seriousness of what you're dealing with and can help you maintain the lifestyle changes necessary for healing. The social pressure to eat normally or not be so extreme can sabotage recovery efforts when people don't understand that you're fighting for your life, not just trying to lose weight or get healthier. Monitor your progress through both skin improvements and laboratory testing every 3 months initially, then less frequently as your condition stabilizes. The skin changes we've discussed should begin improving within months of implementing proper interventions, and blood markers should show significant improvement even sooner. Most importantly, understand that this is not a temporary diet or exercise program. This is a permanent lifestyle change necessary to prevent life-threatening complications and potentially save your life. The skin signs you're seeing are final warnings that your body's metabolic systems are failing, and only comprehensive, permanent changes can restore health and prevent tragedy. The choice is yours. Continue living the way you have been and accept the statistical likelihood of serious diabetic complications within the next few years, or make the dramatic changes necessary to heal your metabolism and watch these skin warnings fade as your health improves. Time is not on your side, but knowledge and action still are. What you do in the next few days will determine whether you become another statistic of preventable diabetic complications or someone who recognized the warnings and took action to save their own life. Today, you've discovered information that could literally save your life and the lives of people you love. We've revealed the 4 critical skin signs that indicate advanced diabetes in people over 60, the dark, velvety patches of acanthosis nigricans that appear on your neck and underarms, the mysterious brown spots of diabetic dermopathy on your shins and arms, the potentially fatal thin patches of necrobiosis lipoidica, and the rare but revealing diabetic blisters that indicate severe metabolic dysfunction. More importantly, you now understand that these aren't cosmetic issues or normal signs of aging. They're urgent warnings that your body has been sending for years, while diabetes silently destroys your health from the inside out. By the time these skin changes appear, you're already in the advanced stages of a disease that kills thousands of seniors every month through heart attacks, strokes, kidney failure, and other preventable complications. But you also now possess the knowledge and tools necessary to fight back. You understand the immediate actions required: comprehensive diabetes testing within days, not months. Emergency dietary changes that eliminate blood sugar spiking foods completely. Exercise protocols that actually reverse insulin resistance rather than just maintaining general fitness. And the crucial importance of sleep quality, stress management, and environmental toxin reduction in healing metabolic dysfunction. The stories I've shared today illustrate both the tragic consequences of ignoring these warning signs and the remarkable recoveries possible when people take immediate, comprehensive action. The difference between becoming a victim of diabetes complications and someone who reverses their condition completely often comes down to how quickly and decisively you act when your body shows you these warning signs. Your skin has been trying to save your life by displaying these urgent warnings. The question now is whether you'll heed those warnings and take the decisive action necessary to reclaim your health, or whether you'll join the millions of seniors who dismiss these signs until it's too late to prevent life-threatening complications. The medical system has failed to educate people about these early warning signs, and the pharmaceutical industry profits from keeping people ignorant about early detection that could prevent the need for expensive medications and treatments. But you now have knowledge that puts you ahead of these systemic failures and gives you the power to protect your own health. If this information has opened your eyes to warning signs you've been ignoring or given you the knowledge to help someone you love, please share this video with others who need this urgent information. Hit that like button to help YouTube's algorithm show this life-saving content to more people who desperately need these warnings about their health. Subscribe to this channel and turn on notifications so you never miss crucial health information that could save your life or the lives of people you care about. Your subscription helps us reach more people with urgent health warnings that the medical establishment often fails to provide. Remember, These skin signs are not death sentences. They're opportunities for early intervention that can add decades to your life and save you from devastating complications. But only if you recognize their significance and take immediate action to address the underlying metabolic dysfunction they represent. Your health is in your hands, and the time to act is right now. Don't let another day pass while these warning signs progress and your window for easy intervention closes. Take action today and transform these urgent warnings into the wake-up call that saves your life.